Have you ever noticed a new rash on your child's skin and wondered what it might mean? It can be a little concerning, right? Well, one really helpful thing you can do when checking a rash is to see if it blanches when you press on it. Blanching simply means that when you gently press on the rash, the red or discolored area temporarily turns pale or white, and then the color quickly returns when you releases the pressure. This reaction, or lack thereof, tells us something important about what is happening beneath the skin. When you press on a rash, you are applying pressure to the tiny blood vessels, called capillaries, in that area. If the rash is caused by blood pooling within these vessels, the pressure temporarily pushes the blood away. When you remove your finger, the blood rushes right back, and the color reappears. This is why it turns white and then immediately goes back to red. A rash that blanches typically indicates that the redness is due to inflammation or dilated blood vessels. On the other hand, if a rash does not blanch, meaning it stays red or discolored even when you press firmly on it, it suggests that the discoloration is likely caused by blood that has leaked out of the capillaries and into the surrounding skin tissue. This usually points to tiny bleeds under the skin, often called petechiae or purpura, which do not disappear with pressure because the blood is no longer contained within the vessels. This distinction is crucial because non-blanching rashes can sometimes be a sign of more serious conditions that requiring immediate medical attention. To test for blanching, find a clear drinking glass or a smooth, transparent object. Gently place the side of the glass over a red area of the rash and press down firmly enough to make the skin underneath pale. Hold for about 5 seconds, then lift the glass. Observe carefully whether the color returns to the rash when the pressure is removed. Make sure to check several different spots on the rash to get an accurate idea. Understanding whether a rash blanches is a foundational assessment in dermatology and pediatrics. It helps healthcare professionals quickly narrow down the potential causes of a rash, often guiding further diagnostic steps. For example, many common viral rashes, hives, or conditions like roseola often blanch, while rashes associated with certain bacterial infections like meningitis or bleeding disorders typically do not. Knowing this simple difference can help you provide clearer information to your doctor and understand their initial assessment. So, by knowing what blanching means and how to check for it, you gain a valuable tool. It allows you to quickly assess a significant characteristic of your child's rash, helping you understand when a rash might be less concerning and when it might warrant a more urgent call to your pediatrician. This simple observation empowers you with a key piece of information for managing your child's health.